By the end of this presentation, you will learn more about the psychobiological eating disorder anorexia nervosa. To introduce myself, my name is Tracy Sagum from Quezon City, Philippines. My presentation will take about 15 minutes and is divided into 6 sections. Here is the table of contents for my presentation. Let me start my discussion with an overview of anorexia nervosa. It is an eating disorder characterized by unusually low body weight, a strong fear of gaining weight, and a distorted perception of weight. Anorexics place a high emphasis on managing their weight and shape, putting in excessive efforts that drastically disrupt their lives. Contributing factors of anorexia nervosa. The following factors may have a role in the development of anorexia. Genetics. People with siblings or parents who have an eating disorder are 10 times more likely to acquire one themselves, implying a genetic connection. Trauma. Many specialists believe that anorexia are triggered by people seeking to cope with overwhelming feelings and painful emotions through dietary restriction. Physical or sexual abuse, for example, might lead to the development of an eating problem in certain people. Environment and culture. Cultures that idealize a specific body type, commonly thin bodies, can put undue pressure on people to meet unrealistic body standards. Peer pressure. Peer pressure may be an extremely strong force, especially for children and teenagers. Teasing, bullying, or criticizing based on one's looks or weight might lead to the development of anorexia. Emotional health. Perfectionism, impulsive behavior, and stressful relationships can contribute to a person's poor self-esteem and perceived self-worth. Second section is the anatomy and physiology of the brain of an individual with anorexia nervosa. Researchers say people with anorexia may have unusual brains, which could influence their thoughts, feelings, and habits regarding eating. First, according to research, altered brain serotonin function contributes to disturbances of hunger, mood, and impulse control. Patients with eating disorders typically demonstrate perfectionism, obsessive compulsiveness, and dysphoric mood, all of which are controlled in the brain by serotonin pathways. Second, brain imaging technologies enable a better understanding of the etiology of anorexia nervosa. In comparison to controls, the individuals with eating disorders who are critically unwell and those who have recovered exhibit abnormalities in the frontal, cingulated, temporal, or parietal areas of the brain, or a combination of these regions. Lastly, research indicates that persons with anorexia nervosa have a difference in the reward and executive function areas of their brains. Third section is the patient profile I created for an anorexic who is nearing discharge. AJ, a single 17-year-old female living in Regina, Saskatchewan, with a diagnosis of sudden worsening of anorexia nervosa and hypotension related to dehydration, presented to the tertiary care center with complaints of gradual loss of weight with no known comorbidity and allergy. She lives with her parents and a brother in a 3-room apartment, having her own room. Upon assessment, she has good relationships with family and friends, got good grades in school, and had a happy childhood. In their culture, family members play a large role in healthcare decision-making. In the last quarter of 2020, AJ's mind was preoccupied with increasingly negative ideas about her appearance, and pandemic limitations prevented her from engaging with classmates. Her parents had grown concerned about how little she was eating and urged to see a doctor. In 2021, psychoeducation was given, nutritional rehabilitation was planned, she was asked to maintain a diary about her intake of food and encouraged to eat food with high caloric value. Post-sessions with the family was involved in the therapeutic process and was asked to keep a watch on her behavior. Her weight gain after 1 week was 2 kilograms. She gradually became cooperative for treatment process. supportive psychotherapy was planned that provided a maximum understanding of her perspective. At the end of 2 years, her weight was 55 kilograms with no new complaints. In May 2023, there were recurrent episodes of vomiting and a gradual loss of weight, with a probable precipitating factor of peers' critical comment on her weight gain. Her parents received a phone call from school to say that AJ had fainted and was rushed in the hospital. Fourth section is the nursing process, assessment and therapeutic communication skills. During the nursing assessment, one of the questions asked to AJ was, "Do you induce vomiting because you feel uncomfortably full?" It is an example of therapeutic communication skill of giving broad opening and using open-ended sentence. This nurse therapeutic communication strategy works well because it allows AJ to direct the course of the conversation. Open-ended inquiries challenge AJ to put effort into her responses and provide more than a yes or no answer, which can assist nurses in determining what is wrong with her. Another question was, "Do you consider yourself fat while others say you're too thin?" It is an example of therapeutic communication skill of exploration. When speaking with AJ, pay close attention to what she says and try to apply it to the present situation. Asking direct questions or making specific remarks can be used to express exploration as part of the therapeutic communication. Nursing care plan. During admission, nurses and AJ establish plans of care. First diagnosis was imbalanced nutrition, less than body requirements related to insufficient food intake, and self-inflicted vomiting after eating, secondary to anorexia nervosa as evidenced by too much lost body weight. Goal was AJ will demonstrate weight gain toward the individually expected range within 4 weeks starting May 23, 2023. Intervention was to expect a weight gain of about 0.5 kilograms per week. Nurse evaluation was goal ongoing. AJ established a dietary pattern with caloric intake adequate to regain an appropriate weight. Outcome was AJ gained weight of 2 kilograms after 3 weeks of admission. Another diagnosis was deficient fluid volume related to insufficient consumption of fluids and recurrent episodes of vomiting, secondary to anorexia nervosa. Goal was AJ will maintain improved fluid balance within 4 weeks starting May 23, 2023. Nursing intervention was to strictly monitor the amount and types of fluid intake and measure AJ's urine output accurately. Evaluation was goal met. AJ maintained fluid volume at a functional level, as evidenced by adequate urine output, stable vital signs, moist mucous membranes, and good skin turgor. Outcome was AJ maintained fluid volume at a functional level after 2 weeks of admission. Fifth section is the pharmacological intervention. Medication has yet to be proven useful as the first line of therapy for anorexia nervosa according to research. A typical antipsychotic drug such as olanzapine was prescribed to AJ. It can aid with mood improvement, obsessional behaviors, and resistance to weight gain. Patient teachings for olanzapine are the following. Olanzapine comes as a tablet and dissolves quickly in the mouth. It is usually taken once a day with or without food. It is taken at around the same time every day. Be sure to drink plenty of water every day while taking this medication. Do not take more or less of it or take it more often than prescribed by the doctor. Do not try to push the orally disintegrating tablet through the foil. It may help control your symptoms, but it will not cure your condition. Tell your doctor and pharmacist if you are allergic to olanzapine or any other medications. Tell them what prescription and non-prescription medications, vitamins, nutritional supplements, and herbal products you are taking or plan to take. Tell the doctor if you have any condition that makes it difficult for you to swallow, trouble keeping your balance, high or low blood pressure, a high level of fats in your blood, a low number of white blood cells, liver or prostate disease, paralytic ileus, a condition in which food cannot move through the intestine, glaucoma, an eye condition, or high blood sugar. Tell your doctor if you have constipation, severe vomiting or diarrhea, or signs of dehydration. Tell your doctor if you are pregnant, especially if you are in the last few months of your pregnancy, or if you plan to become pregnant or are breastfeeding. If you are having surgery, including dental surgery, tell the doctor or dentist that you are taking olanzapine. Olanzapine may make you drowsy. Do not drive a car or operate machinery until you know how this medication affects you. Alcohol can add to the drowsiness caused by this medication. Do not drink alcohol while taking olanzapine. Tell your doctor if you use tobacco products. Cigarette smoking may decrease the effectiveness of this medication. You should know that you may experience hyperglycemia while you are taking this medication, even if you do not already have diabetes. Tell your doctor immediately if you have any of the following symptoms while you are taking olanzapine: extreme thirst, frequent urination, extreme hunger, blurred vision, or weakness. You should know that olanzapine may cause fast or slow heartbeat, dizziness, lightheadedness, and fainting when you get up too quickly from a lying position. Tell your doctor if you plan to do vigorous exercise or be exposed to extreme heat. Sixth section is the patient resources. There are a number of community support resources available in Regina to help AJ in the recovery process once discharged from the hospital. First, Four Directions Community Health Center Living and Balance. It is a healthy life skills program that teaches tips for healthy eating, physical activity, and enjoying a healthy lifestyle. Sessions include a hands-on cooking circle and fun activities. Included also in the contact information are their address, business line, website, Facebook page, and Twitter account. Second is nutrition services provided by Regina Community Clinic. A nutritionist is available to provide individual nutrition counseling and group education on a variety of topics including weight management and eating disorders. Included also in the contact information are their address, business line, fax, and website. Lastly, presentations and workshops provided by Sojonki Counseling Services. It provides presentations and workshops for groups in need of mental health support on issues such as eating disorders. Included also in the contact information are their address, business line, website, and email address. There are a number of crisis intervention resources available in Regina for AJ. First is crisis services provided by Mobile's Crisis Services Incorporated, Regina. Anybody can call their 24/7-hour general line if a person are in or about to experience a crisis situation and needs assistance. Included also in the contact information are their address, business line, hotline, website, and email address. Lastly is Piwapan Women's Center Crisis Line. Northerners supporting Northerners. Staff have received training in suicide prevention, mental health supports, grief resolution, and trauma-informed care. They will listen without judgment. All calls remain anonymous and confidential with the exception of duty to report situations. Included also in the contact information are their mailing address, shelter services contact number, 24/7 crisis line number, website, and Facebook page. That brings me to the end of my presentation. I hope you have learned something about anorexia nervosa. Here are the reputable references I used in my presentation.